Assalamu alaikum, it's me Dr. Muhammad Naseem Shirzad, and today I am going to answer some of the question of a student regarding the preparation for FCPS Part 1 exam. Like many student asking sir how to prepare for this exam. So this exam and exam everywhere in the world needs some sort of homework, some sort of research. Whenever you are going to affair for any exam, like for FCPS Part 1 exam, you need to do some homework. So FCPS Part 1 is exam of basic medical science. It's not a sort of exam on clinical things. So you should to be very clear that it's need all your MBBS course, but that in a smart way. Like I will be unable to cover all that Snail, all that Guyton, all that Kaplan, all that first aid. So that's a difficult task. For that I need one and single theory book which cover all my CPSP syllabus, CPSP question, but again that should be on the basis of your theory, on the basis of your concept. So keeping all these things in my mind when I was preparing, so I thought why not write a book for FCPS Part 1 exam which should cover all my CPSP syllabus, that should be authentic, that should cover all the syllabus of FCPS Part 1 exam, all the multiple choice question of the FCPS Part 1 exam. So Naseem Shirzad FCPS Part 1 I have written with that thoughts. Now how to start your study? Number first, you need this exam need your time, this exam need your sincerity. If you don't have time, if you are not sincere and you unable to give any time and you have a lot of excuses, you will be unable to clear this exam. So it's need your time. Number second, it's need all the books which should be on your table. Now which sort of books I need to have on my table? Number first, my main theory book will be this Naseem Shirzad FCPS I yield, as it covered my all anatomy, physiology, pathology, biochemistry, micro, pharma, according to CPSP syllabus, right? And along with that, I need to have some local book of MCQs, which is systemic. So try one book which is written in a systemic format, in a modular format. These two should be your main book. After that, you need some reference book on your table, which if you find any difficulty in this Naseem Shirzad FCPS high yield, you can review that topic from that reference book. So that reference book which should be on your table, that should include Snell, that's include BRS physiology, that's include first aid, that's include Atlas on your table, that's include Kaplan neuro and Kaplan embryology. Like now how to start study? Like for example, I just want to give you one example. Like this is a chapter of GI anatomy from Naseem Shirzad, and I will be starting my study like this. First this table, and after that I will be covering my this topic of esophagus. Now this each and every line of this topic of esophagus is basic news. So from studying this, like I have written full anatomy, esophageal construction, then the blood supply, then the venous drainage, then the lymphatic drainage, then the histology. So if you cover this topic properly, like I have written with each part of the esophagus, their blood supply, their venous drainage, their lymphatic drainage, their epithelium, and the commonest carcinoma. Then again coming into the histology, the gastroesophageal sphincter, then the deglutition or swallowing, and again then going toward the pharyngeal stages, the esophageal stages, and again at the end Naseem Shirzad high yield points. So if you cover a single topic of esophagus from Naseem Shirzad, and after that try to practice basic use of same topic, if you are able to cover and solve basic use of this topic from any systemic basic use book, then it's fine. If you don't, if you are unable, around 90% you will be able to solve the basic use. 2 or 3 basic use will be looking difficult for you. For that, you need to open that reference book which I have already mentioned, that should be on your table. So with this way, you will be completing this whole book. Like for example, now coming into the stomach retin and histology, parts, gastric gland, and toward the venous drainage, lymphatic drainage, celiac plexus, embryology, and then coming into the various surgeries and outcome, because they are asking an exam, and then coming into the various type of ileostomy, colostomy. So if you cover this whole book in this way, you will be having a good command around 90% of things of FCPS part 1 exam, and it should be on your fingertip, and it should be revised at least 2 times. So this is the way forward. If still you have any question, you can comment.